Dr. Rosemary Hunter, Dr. Katie Spencer, both from Vanderbilt Children's Hospital, joining us tonight, talking just a wide variety of specific checklist items as we help our kids continue to have the healthiest, best summer possible, and heading back to school. Three weeks, maybe? Sorry, kids. Parents are probably going, yeah, we're ready. But we're glad you're here. Thank you on a Monday on OpenLine, and thank you for Teresa, I believe, the caller. If you'd like to call in, our last full segment here, got about 10-15 minutes, so if you have a question or comment, please let us know. Okay, healthy body and mind overall, immunizations.
Yes.
You know, first of all, we hope that you have a regular, trusted pediatrician for your children. But it's time to take a look at your immunizations, your records for your kids. I know kindergarten, 7th grade, Metro is pushing. Tell us about what kids need as they head back to school.
Yes, so we encourage all folks to check in with their pediatrician, to make sure that their children are current and up to date with their checkups, which we usually encourage for school-age children, or usually once every year, and that their vaccinations are up to date. The school system normally has these two main checkpoints. One is the entry to kindergarten, and one is the entry into 7th grade, where they will review the record to make sure you've received the vaccinations due for school entry.
And as far as COVID is concerned, we know the emergency use authorization has been approved for kids pretty much all ages now, 6 months and up. Is that right? Emergency use, and then I know that Pfizer or Moderna, I can't keep up with it, is applying for just regular full authorization. Where are we with that? And obviously, it's up to parents if they would like to, you know, especially the real young kids, decide to get them the shots.
Right, so we've had the approval for 12 and up for quite a while. The 5 to 11-year-old age group has been over a year now, so we do have a lot of experience with that. And in fact, they're now actually due for a booster if it's been more than 5 months since they completed the primary series. And then, of course, you've heard the news that the 6 months to 4 years age group is now more recently approved for the COVID vaccine.
Right, and we should mention too that obviously this is not the same dose as adults. For Moderna and Pfizer, it is a different level, but it's obviously a reduced dose for these kids.
It's a much smaller dose for the younger children age group, and the dosing interval is slightly different because of the smaller doses, and the number is also slightly different for the 6 months to 4 years.
What do you say to a parent, a family you're treating, some patients who say, gosh, I've got my concerns, you know, I have maybe a 7-year-old, a 6-year-old, here's where I am, and then you give them the best advice based on your experience, right?
Definitely, definitely. These vaccines have actually been studied in tens of thousands of children now, and we have delayed their production, not the production, but the release of the guidance until we have enough data to support their safety and their efficacy in preventing COVID disease and severe illness. So, we do have a lot of data around this, but we do want people to talk to their pediatrician so they understand
there's so many factors.
And
based on maybe medical history, whether you're an adult or child, there's just a lot of factors. I did the same thing, talked to my primary care physician and made my decision based on that. But we are learning a lot because we're a couple of years out, and so far, I mean, what we've seen is the vaccine has been effective, especially with boosters and especially with people who have compromised immune systems at maybe reinfection. Just kind of, you can still get COVID, but the symptoms may not be nearly as severe as what we saw in the beginning of the pandemic, which was just terrible.
Right, so the main endpoints that when we looked at these vaccines were hospitalizations and death and severe disease. So the vaccines are highly protective against those significant medical outcomes. Does not mean you might never get COVID,
Oh, yeah.
but that the symptoms will be much less, and you that you will tolerate it better.
And like I said,
If you have strengthened.
as you know, the studies are always running, trials and studies, and we just keep learning more and more. And so you got to pay attention, because we just want to keep the kids as safe as possible. Speaking of the pandemic, let's get back to that. We began talking a little bit about that, but the same thing in your line of work. You're going to be seeing and gathering information for a while, studying the impact emotionally, mentally on our kids. What are you pretty sure of right now, of what you've seen and what needs to be done?
I'm pretty sure that many communities could benefit from more mental health resource access. And I think that these children who are engaged in therapy really do benefit from in-person treatment at times. I think we're still playing catch up with some of the more intensive behavioral therapies for children with autism and other neurodevelopmental disorders, and that it will take us time to see that level out. And it may continue to be on the rise for a period of time due to the aftermath of the last several years.
You know, we know the Department of Children's Services on the state level, they are in dire need of social workers to work these cases. I mean, they're just overwhelmed, and we've been doing stories on this all the time and watching how the state is responding. But obviously, more resources, and with rising prices, the salaries are just going to have to go up. So access to more resources, mostly in rural areas, or is it pretty much happening all over the place? Because we know in so many rural areas in Tennessee, you have to drive maybe 100 miles, not only to get to the nearest hospital, but for specialists or for psychiatry and the like.
I think it's regardless of your community, it can be hard to find a provider. Absolutely. And we can certainly use amazing resources like Mobile Crisis or Mental Health Co-op and some other organizations that support us here in the Nashville area. But even our case managers at Vanderbilt, we're really working closely to try to find resources that fit the patient's needs.
I would imagine that this is communication among the major hospitals and doctors. They're all feeling the same thing, and you can get together and push. I mean, we have so many great nonprofits out there who are working hard, but they're relatively small. So you combine that with state and federal dollars and programs, which obviously we need to convince the people in charge with the purse strings, this is a need. How can we get this? And it's going to take a while. Is it just fewer people, young people getting into pediatrics, or is it convincing those who are in it, hey, we need more resources, anyone want, we need more people here, and here? Or probably all of the above, right?
Probably all of the above. I mean, I think
think
that
so.
Working with the pediatric residents at Vanderbilt, they're learning about mental health and the impact on children after the pandemic, and that's a very important part of their education. So I think that over time, hopefully we'll build this up, but the problem was on the rise more than the providers were on the rise. It was already happening, and this was just like lemon juice in a wound.
Yeah, and it's, there's questions about all the money from the American Rescue Plan and how it's being used, and we know there's still communities still have a lot of money they're waiting to look at where to direct those federal funds, and hopefully, this is one of the areas where they can invest more, because the experts, I mean, we've heard this before, are telling us we need it for sure. So kids go back to school now. They hopefully go visit their pediatrician. They get up to date on their immunizations. They're ready. Teachers have to be ready too, because here we go again. We're back. So many things have happened. So hopefully school districts have to be on board. Many school districts have counselors on site or covering a couple of schools. What do you see happening? Fingers crossed, what's the best case scenario for overall mental health for everyone, teachers and the students, so that they can really hit the ground running and, okay, let's be productive and catch up?
there's always opportunities for communities, schools to come together and promote growth after a traumatic experience or the last several years. So I think there's hopeful opportunities of people coming together, supporting one another, and children accessing resources.
And maybe just letting the kids talk about it.
Absolutely.
You know, tell us about the last few years, and or maybe write an essay on it or whatever. Just get it out there so they can share their feelings overall. You mentioned, Dr. Hunter, the diet and whatnot. I mean, I know in the beginning of the pandemic, you know, stepped on the scale after a couple of months. We all went through that with ordering in and getting used to just kind of letting everything come to us, not being as active. But again, I'm sure you're encouraging the families and your patients, let's get back out there and get some fresh air and get active, start moving.
Correct. It is, I'll tell you though, with this heat lately, you do have to be creative.
Early in the morning?
Early in the morning or
evening.
in the dusky evening where it's starting to cool off a little bit. But trying to get out, luckily it's late. So perhaps that extends the amount of time you might be able to play in the yard in the evenings. Wear your bug spray though. Don't want to try and get too many mosquito bites. We see a bit of that. Well, yes, during the day, definitely.
From my dermatologist watching, you know.
Sunscreen as well.
But it connects to mental health too.
It
does.
After
Exercise a good day out and the kids sleep
good
better.
For your emotional, mental, and physical health. Regular exercise is just key. And the more you can incorporate it into your life as a family, the more it becomes part of your just family dynamic and your family routine, and it really helps when the parents model this type of healthy behavior of taking care of ourselves.
It does indeed. So now kids going back to school, a lot of classes will be mask optional. We almost forgot there are other things going around like the flu and colds. So we have to prepare for seeing more cases. I mean, you've got kids all in the same classroom and it spreads quickly, as we know, but we have to be prepared for that in the fall, right?
Definitely. All these things tend to, the normal routine viruses also are being spread at school. So wearing a mask can be protective against that too,
and
if
as
they
you
so
said,
choose.
Wash those hands,
and wash
keep your
hands.
distance. So the common sense stuff that hopefully we've learned and we can kind of reduce that. But flu shots usually September, October will be available. I'm sure you recommend those as well, as my doctor does. Get the flu shot to help you out. So listen, we hope that kids, you stay safe. Didn't even have time to get into transportation safety, just getting back and forth to school safely. But whether you're walking or riding the bus, there's a lot of things that you can do to keep your kids safe, and we hope you will look into that. All right, everybody, we are going to take our final break now. We want to thank our guests. We're going to wrap things up after this. Thank you to our one caller, but I know it's nice out. Hopefully you're out with your kids getting some good exercise tonight, and hopefully you picked up something tonight to help out as we all try to move forward. We'll be right back. Open Line wraps up after this.